Hello, my name's Andrew Tressider. I'm a GP by background and I work for Somerset Clinical Commissioning Group on a number of topics, medicines management and staff wellbeing and others.
And I'm Peter Bagshaw. I'm a GP in Somerset and the mental health lead.
Peter, we're talking today about end-of-life care. And what do you understand by end-of-life care?
I don't think there's a precise definition, but it's really anyone who recognises that they're coming to the end of their life through a terminal illness or general frailty. And at that stage, it's really helpful to get into what are people's wishes as they approach the end of their life.
Thank you. My father died very suddenly of a heart attack, so that was a sudden ending. But many people, it's as you say, it's protracted over a period of time, and we dwindle. And it's important to have choices about that. Um, how do we start a conversation with with our GP or our medical professionals about that?
I think the first advice I give is not to be scared. So all doctors and other healthcare professionals are trained in having these sort of conversations. We're very comfortable with them. And in fact, we use things like care plans, treatment escalation plans. So don't be afraid to just ask the question. Look, I think I want to have this discussion, and I'm sure your GP or other healthcare professional will respond sympathetically to that.
Peter, end of life is a tricky topic. Do you think we're good, both as health professionals and as patients, because we're all patients, we're all going to die one day. Do you think we're good at thinking about the topic, or is it one of those things that we tend to put off?
I think it's really tricky. They say, don't they, death is the last taboo. And I think for a lot of us, those stages of grief that you go through as you approach end of life, one of them is denial. So if you're in that stage of the process, then having a conversation is really, really tricky. But I think everybody I know who has raised the subject and we've had a conversation about it, it's been beneficial.
Thank you. And as patients, as carers for loved ones who may be ill, perhaps we can help ourselves by writing down what we want to speak about with our health professionals, including that important topic of end of life care, because writing it down and having some thoughts beforehand may help to introduce the topic.
I think that's really good advice. Often when we come to that, it's a difficult topic to talk about anyway. So having that prompt is really useful.
One of the difficult things about end of life is having that conversation with your loved ones, because it's too painful and we don't want to go there. We don't want to explore the pain. Have you any hints or tips or suggestions about how to start a conversation with our loved ones about what our wishes might be for our last few months or weeks of our life?
I think you're absolutely right. It is painful. And you mentioned your father dying suddenly. I knew my father knew he was approaching end of life when he gave me his stamp collection. And so it doesn't have to be a vocalized thing. You can tell that somebody is starting to make plans for the end of their life. And that maybe is the time to have this positive conversation of saying, is there anything we can do? The phrase put your affairs in order is absolutely right. People like to do that. It gives them a sense of control at a time of their life when it feels as though they have very little control over things.
Peter, as relatives, if we've got somebody who's ill, that we know and love, how can we approach that really delicate topic about them dying and what their wishes might be for the end phase of their lives?
I think that's about being sensitive to what they are feeling at that moment. And it may be for some people that they absolutely don't want to have that conversation. And we should respect that. But if we sense that they may find it helpful to discuss what happens as they're dying and after they die, which for a lot of people it is, then you can just sensitively put those feelers out, see what the reaction is. and depending on their response, take things further if that feels appropriate. So it's about being sensitive and listening hard to the other person.
We're speaking in Somerset, and at Taunton Hospital, we have a care of the elderly consultant who is a published author with her book, Dr. Lucy Pollock's The Book About Getting Older. And I would commend the excellent chapter in there about having these difficult conversations and thinking about end-of-life care.
So, Andrew, if I can ask you a question or two, obviously, as well as the person coming to terms with their own end of life and their very close family, there's a much wider family. How should we have those sort of discussions?
So, Peter, the big barrier for many of us is fear, and we have to just somehow get over that fear and say this is important. This is a difficult thing to talk about, but it is important, and I would like to talk to you about this issue. So both relatives talking to the loved one who is ill and the loved one talking to them. And I would encourage people to explore the topic. There's some good resources on the whole topic of planning ahead for end of life on the nhs.uk website under end of life care, and that gives us some help and some hints as to how we can do that. How would we choose the scene? We would choose a place when we've got space, when we've got time, and when we're comfortable. And a phrase that we could use is so and so. There are some important things that we need to talk about. There are some important things that we need to talk about, because so often we can avoid important issues because they might feel painful.
And perhaps the trickiest issue of all in this is what we say to children, whether we should tell them if somebody is coming to the end of life, or whether we shy away from that, what sort of language we can use that's appropriate. Do you have any advice on that?
It's really interesting how so often we don't want to cause people pain. We want to avoid them being distressed by issues. But experience shows that the shock of not being told and then something serious or disastrous happening is worse than being prepared. The conversation with children, it's important to get it age specific, and there are ways of doing this. And perhaps for small children, an analogy is to talk about water bugs and dragonflies. And here we all are as water bugs swimming around in the pond, and we're happily talking to our friends. And one day we lose one of our friends and we wonder where they've gone, or our loved one, or our grandparent, or other. And then another day we lose another one. And what's happened is that they've climbed up the stalk of the plant, of the piece of grass, the water grass, or other in the pond, and they've flown away as dragonflies. Other age-specific material will, of course, depend on older children who can understand much more effectively. We don't often see death in the home these days. Some of us may have had pets who have died, but compared to 100 years ago, it's uncommon. But that doesn't mean that the conversation shouldn't be had. It's important to have it, and then we can prepare. And maybe if I know that my father's going to die, or my mother, then I can prepare with her a memory box that I can keep. So we can keep memories of good times.
Thank you, Andrew. I think you've helped us understand the importance of having difficult discussions and not shying away from them, and that in the long run, it's a positive thing to have those discussions. Thank you.